is still advice for me. So basically, if I'm mild, without medical treatment, is it possible for me to go back to normal?
Yeah, that's why I'm saying that in the first 6 months, when we say come back in 6 months, there's possibility depending on what, some people say pregnancy, because of the hormonal changes in the body, it affects all the cells in the body. It affects all the cells in the body.
Okay.
So say, for example, we have a smear from a postnatal woman and is mild or borderline, then they'll leave it because it could be due to the hormonal changes she's going through. So if come back in 6 months, at least by 6 months, she will have gone back to normal after having the baby. Our hormones will have changed back to normal. So it could probably be back to normal or stay the same as mild. And if it's the second time, for 6 months, come back in 6 months mild, then we refer for a treatment.
Okay.
But we don't refer on the first mild, it's on the second one. And depending on the local government authority, some authority will say, no, 3 consecutive low-grade abnormalities. So if they say, come back in for 6 months, it's mild, and you come back again, it's still mild, then they won't do anything, they'll leave you. So that's making it 1 year.
Yeah.
So by the end of that year, you come back. If it's still mild or borderline, then they will send you for colposcopy appointment for a further checkup where treatment will be given.
Okay, so when we are moderate, if we are moderate, there's definitely, obviously, no possibility of it regressing back to normal.
No, it doesn't regress back to normal. So with that one, immediately is an immediate referral for treatment. And with those ones, that's when they'll take a biopsy at the colposcopy clinic. It's the same, they use a special microscope to look into the neck of the cervix, and they'll take a biopsy and then take a smear at the same time and then send it to the lab. And then
is the biopsy the swab?
No, the biopsy is not. They use like a tweezer thing to take the sample. It's like they'll numb the area and they'll use the thing like a faucet to take the skin.
So you're actually taking part of my flesh?
Yeah, they're taking part of your flesh.
I understand that.
Thank you. My question is, you've been saying about using an instrument to open the cervix.
Yeah.
Can it be, because it can be painful for some women that they don't go for this test, and what would be your suggestion to help in a situation like that?
Well, the thing is, in the past, they used to use a metal speculum, which is really heavy and painful when they use it to open the neck of the cervix. But now they use the plastic one. And when you go in for a smear test, even me standing here talking to you, I hate going for this smear test, but I have to. So when you go, be relaxed. If you're so tensed, if all your muscles are tensed, it will be painful. But tend to relax and tend not to think about it. Because when I go, I tend to chat the nurse up. You understand? When you're talking, your mind is not focused on what you've come for. So by so doing, you will not feel the pain. So it's best to relax. Because if you're so tense, then it will be painful.
What else apart from hormones imbalance in pregnancy or postnatal pregnancy that can cause mild dysplasia or what moderate or severe dysplasia in the system?
There's some other risk factors, like if you've got low immune system, which I'm going to come to later. If you've got AIDS or you're an HIV positive patient, then you're at risk of having cervical cancer. Or if you have children too early. You know, when children under the, say, probably younger than 25, when you start having children, all the cells in that area are not matured enough, because that's this area, the cells in that area are dividing every time. So the cells in that area are susceptible to changes. So if you've got low immune system or you have children too early, that can cause one to have cervical cancer. Because if, say for example, when you have children too early, people tend to have so many children. And that leads to it because you haven't given your body enough rest to go back to normal before you see some people, they have a toddler, probably 6 months, and they're pregnant already, about to deliver. If they do that regularly, say for the next 10 years, within 10 years they've got 10 children. And by so doing, they haven't given their body enough rest to recover from all the trauma they've put it through. Because pregnancy and delivery, it's not the normal part of our body. Is a situation we're putting the body through. And for the body to get over this trauma, we need to let the body rest. So having too many children, and if there's a family history, say your mother or grandmother have cervical cancer, then the person or the patient might be carrying the gene. So if you've got this gene, if there's a history to say your ancestors or mom, auntie, sister, grandmother have cervical cancer, then that patient is at risk. So they'll probably be on alert with those type of patients to make sure that they come regularly for the cervical smear. And one thing is for the hospital or the PCT to send the letter is another thing for us to acknowledge the letter and go ourselves.
Thank you. I wanted to ask is, you've been given periods of tests, like maybe 6 months later or 3 years later, but there's some kind of cancer that becomes very aggressive, that can, you've heard of somebody that's got cancer, and within three months or 6 months, the cancer has spread everywhere and they die. What about in these cases where they have to wait 3 years for the next test?
Well, if in a case where they do the smear test and they realize that the patient is cancerous, they do immediate referral. They do not wait for the clinic to give you a date. The doctor from the lab will phone the GP and say, send this patient straight to the clinic within the next 1 or 2 days for treatment. So if it's a case that it's already spread, the only thing they can do for the patient is probably take the whole womb out, the ovaries and everything, so that it would not affect all other parts of the body, depending on how far gone it is when they look at it under the microscope. There's some that when they look at it, they could just take the womb out, leave the ovaries and the tube. And there's some that is gone further in, that they have to take the whole thing out. So it depends on how far gone it is.
So you can't be normal first. Let's say you've been going and it's been normal. And then before the next test, develop this cancerous cell.
If you go regularly, on the 3 years recall, you go regularly, at one point, they will be able to pick it up, that there's something wrong. And if, say for example, that's why these slides are kept in the hospital till the patient dies. It's kept till the patient dies. So if, say for example, you come this year, it's normal, and we ask you to come back 3 years' time. You come back in 3 years' time, there are some abnormalities in it. We will go back to this one, go and bring this one out, and look at this one again to see if it's been missed, because they could be false negative or false positive. And in the lab, 3 people screen one slide. If I look at it, I write my opinion, I pass it on to the second person. If the second person agrees with me to say, okay, it's negative, then it goes out as negative. But if the second person thinks, oh, no, there's some cells I see I'm not happy with, they will dot it and then pass it to the third person. And then the third person looks at it. If the third person agrees with the second person, then it goes to the fourth person. So it goes through different stages before the result is being sent out. It's not just one person looking at this one slide. It's about 3 to 4 people that looks at one slide at every time the smear is taken.
And the last question, please, is what ages do you stop checking it?
It stops at age 65 if you haven't smeared regularly. But if you've never had a smear before and you come at age 65, they would not turn the patient down. We've had a case of a 70-year-old woman come for a smear test. Why? When we looked at the history written on the form, she was bleeding abnormally, and she had a test done about 10 years ago. So when she went to the GP complaining about abnormal bleeding, then the first thing they did was have a smear done, and then further investigation will be done on her. Because at the age of 70, you're not meant to be bleeding. By that time, you should be post-menopausal. So if they're bleeding, then there's something wrong, and it needs investigating. So the normal age when the smear test stop is 65.
I see, because I was not comfortable. There was a time I was not comfortable in myself last year, and I went to my GP. It was even the practitioner nurse, and I asked her, could I have a smear test done? And she said, oh, no, we don't do it for anybody over 65.
But you could have asked her, because at times, you know, there's the government keep these GP surgery funding for these tests they're doing. So it could be they haven't got funding, but if you persist and give reason why you want it done, they will do it for you.
And can drugs affect, let's say you're on a lot of drugs, can it affect, your cervix to change? Or
If you, like the contraceptive pills, that affects, if you've been on it for a very long time, it affects the cells in the cervix. That's why normally they say, don't stay on the pills for too long. The coil as well, it's not good to be on it for too long. They tell you probably minimum of 5 years, go on it, come off it. Let your body rest, and then if you want to go back onto it again, you go back onto it. And then they've noticed that people on pills or coils, they tend to be promiscuous. Because, okay,